Hello everyone, and welcome to another Bugs of the Month series. Now today I'm going to show you a case of an endoscopic biopsy from a 64-year-old male patient. He actually presented to our hospital with several complaints, one of which was abdominal discomfort and night sweats, fever, and the other had to do with prostate hypertrophy. And while the urologists were working up for surgery, they realized that he was HIV positive. And the gastroenterologists, they were also working him up, and they performed an endoscopy. And over here, as you can see in the endoscopy specimen, they saw nodularities beneath the mucosa, and they biopsied one of these nodularities. And in the biopsy sample, what we saw, this is a biopsy from the duodenum. As you can see the villi here. In the lamina propria, there was this diffuse area composed of sheets of histiocytes, as you can see here, and they're scattered eosinophils in between. And there's this second sample, which actually is probably more representative of one of those nodules, where you can see that actually the villi, they've like flattened out, and the lamina propria has been diffusely infiltrated with these histiocytes. And of course, you probably, as you might guess, with a history of HIV, we did bug stains, and these bug stains revealed these histiocytes to be stuffed with acid-resistant bacilli, which you could easily make out even without oil immersion. But I'm still going to do oil immersion just because it looks neat. Here we go. We can see these shorter bacilli, these histiocytes are actually stuffed with them. There's so many, as you can see, within the cytoplasm of the histiocytes. Small bacilli. Now, this is a severely immune-compromised patient, of course. Just to look at the spectrum of this is, of course, the Mycobacterium avium intracellulare MAC complex. And this other patient I'm going to show you is probably Mycobacterium tuberculosis, and this patient is not as severely immune compromised. This is a patient from an outside hospital, so I really don't know the details of the clinics, but I presume that this patient is also immune suppressive. You can see that there's huge areas of necrosis here. This is a lymph node, and you can also see histiocytic rimming of these necrotic areas. So you can see necrotizing granulomas. You can see the histiocytes here. And the reason I think this patient is also immune suppressed, but not, of course, as severe as an HIV positive patient, is because with this patient, when again you perform the bug stains and you zoom in, let me just, you can identify a lot of bacilli within the histiocytes surrounding the necrotic areas. These are longer. These are most probably Mycobacterium tuberculosis. But as you can see, each area has several of these bacilli. If we, on the other hand, are to look at an immune-competent patient, which is this next biopsy, where again you can see large areas of necrosis, rimmed again by histiocytes And there's also some suppuration here. Let me zoom into the histiocytes. But this time, it took me far longer to actually find the bacilli because there were so few. This time there's no way you can see them with low power, so I'll have to like use oil immersion and zoom in with the 100x. And this time you have to actually look for them. I'm going to find it. And here we are. Here's one bacilli. It takes some time to find this time. This being an immune competent person. And here's another one. And here's one more. So it's much harder, much more difficult this time to actually find the very few number of mycobacterium that are in this tissue. So as I said, this was a short glimpse at the spectrum of mycobacterium infections that you can see in a biopsy sample. Thanks for watching. Bye.